Hey everyone, Dr. Durrani here again, another episode of Scrubs and Software. First of all, thanks so much for the positive feedback on the two previous episodes. Lots of comments, lots of debate and interactions going on LinkedIn and elsewhere, and so I really appreciate that. Please keep the feedback coming. Second point I want to make is if you're watching this and you're a developer, you have a company, or you have a piece of software that is geared towards healthcare professionals or in-hospital use, or even wearables or things that are connected to patients, if you want me to review it and create one of these little small episodes around it, happy to do so. Please reach out. You can message me on LinkedIn. That's probably the easiest way to do it. So today's episode is about AI scribes. I had to do an episode early on about this, right? It's probably the AI tool that I use the most in my day-to-day in clinical practice. It's probably the one thing that's helped me the most and helped me focus on patients and spend more times in the room with my patients. And so I've used a few of these. Many of them are really, really good. I'm really impressed with how good they are, how early we are in the process of kind of these tools being rolled out. I'll focus on one, probably the one that I use the most, which is Ambience, and it's probably one I use every single day, many times a day, almost every patient encounter. There's lots of pros to this, a few cons, but I really enjoy using it. So I'm just going to open it up. So it's this app that you can just open up on your phone. If you haven't used one of these and you are someone who practices quite a bit, full-time, maybe part-time, whether you're in the outpatient setting or inpatient, I would urge you to just give it a try. And most of these actually have free trials associated with them, so you could have a few interactions with patients for free without having to pay for them. I'm just moving this to the side so I could see it. So this is what it looks like when you log in. And so if you are in an outpatient setting, you'll have your scheduled patients here and you'll be able to see them here. This is also a feature that I personally use when I'm in the ER, because this is actually integrated with Epic in the hospital that I work at. And so the nice thing is when I sign up for a patient, it'll populate on here and then I can just click on the patient. But very commonly what happens is, someone comes in CPR in progress, or they're altered and they can't talk to us. It's an emergent situation, obviously it's an emergency department, right? And so they're not going to be registered for 15, 20, 30 minutes, but I still may want to record what EMS is telling me. And they're telling me a lot of important information in a very small amount of time. And so I definitely want this to be going. And so in that case, what you can do is you can kind of manually start an interaction. You could put in the name of a patient, put in age, let's just say 35, male, and then you can start the recording. And it will basically look like that. It'll start the recording. This is kind of giving me this error message because obviously I'm connected to a different microphone. You could pause it. So like if a phone call comes in and you have to tend to a phone call, you could pause it and then resume once you go back into the patient room. And then once you're kind of done with that interaction, you can click slide to generate note, and it will kind of populate. And I'll kind of show you exactly what the output looks like here in a minute. The other thing that I want to show you is you could actually, so the default thing I actually have it on is patient acute list. And so that's when it'll kind of, like if I was working today and I signed up for patients, they would kind of show up here. I'd be able to click on them and it would automatically put in their name, age, and everything. And so the nice thing is when it then generates a note, it'll say, Rhonda, who is a 45-year-old female, and then it'll kind of go into that interaction and whatnot. And I think now would be a good time to switch to exactly what that example note is going to look like. Okay, so this is actually what it's going to look like when you log into the browser portion of it. And this is just a simulated fake patient visit that I kind of made around a 35-year-old with abdominal pain. And so it'll suggest ICD-10 code. So this was a guy with, basically I'm simulating appendicitis. So abdominal pain, right lower quadrant. He did have type 2 diabetes, so that would be a valid ICD-10 code. And then what we have here so far. So I can just add them all, and then I can confirm the 4 diagnoses. And so this will be the note it gives me. So you could see it says it's a patient, 35-year-old male with history of type 2 diabetes presenting with right lower quadrant pain. And I'll kind of let you read through that, but you can see it kind of captures what a normal HPI note in the ER would look like. And I've actually had many hospitals say, hey, your notes are actually much better with you using this kind of AI scribe, and it gives us much more information and captures a lot more stuff. So the hospitals love it from the ER perspective. Allergies, medications we talked about, his previous surgeries and whatnot. And then it does the review of systems as well. If I talked about diagnostics, so I didn't talk about diagnostics in this example, but if I said, hey, we're going to order a CT scan and we're going to do this and we're going to order this other test, it would pop up here. The physical exam is there as well. So the physical exam is a bit tricky. Obviously it's not watching me do the exam, and so you would have to basically verbalize things. And I personally, to be honest, don't do that because I feel like it's weird. But what you would really have to do is, like, when you're pushing on the patient's abdomen, say, oh, I see it's not tender anywhere but the right lower quadrant, or oh wow, your tongue looks dry, you have some dry mucous membrane. So you would have to really verbalize things out, and it does a good job of catching that. I just feel like it's unnatural, and it's probably quicker and easier for me to just input those things manually. And then it actually puts together a pretty good MDM. So I did discuss in this example, I was going to order analgesia for abdominal pain, discuss evaluation plan, and answered questions. He had no further questions at that time. The diagnostics that I was going to order, and then the diagnoses that we have so far, and that is it. And so there's two ways you could do this. You can copy and paste each one of these sections in, or with Epic there actually is an integration, so it actually pulls it into Epic. You can kind of edit things here and there, and then pull it into your primary note. For me personally, I on average see about 2 patients an hour in the ER. I still see 2 patients an hour in the ER. This hasn't made me into like a super ER doc where I'm seeing like 4 patients an hour. But what I have noticed is I'm staying less after shift, finishing up my notes. Usually I used to stay maybe not that long. I would say pretty efficient with completing notes. So it'd take me about 20-30 minutes post-shift tops to finish up my notes and leave. Now I'd say I usually leave on time, but also during shift I feel less pressured. So I'm doing more frequent reassessments, which I feel like it's making me obviously a better physician. I'm catching on more things. I'm able to address more of patients' concerns. And I feel like that's why I personally, and most of us, got into medicine, to be able to do things like that. As I mentioned, there's many versions of AI scribes out there. I've used a few others, Clio Health, DAX, there's a couple others. They're all really, really good. Some of them have pros and cons. I would say this one and Clio, ER specific, they're really good out of the box. Some of the other ones you have to kind of prompt, help train it a bit more, make custom templates, things of that nature. But with this one, I really love how it's kind of ready, it's out of the box, and it is integrated for our hospital system with Epic. But yeah, this is probably one of the AI tools that I think most people have exposure to, and if you don't, I would say this is a great entryway and entry point into looking at what AI tools can look like and how they can be used to eliminate physician burden and allow us to spend more time with patients and obviously get home on time and all the positives, rather than some of the negative things that AI of course can be used for. So if you have AI scribe tool out there you want me to take a look at, let me know. Obviously other tools you want me to assess or take a look at, let me know as well. And thanks for tuning into this episode.